Okay, well, welcome everyone. My name's Sarah Chessell. I'm the lead for the Dorset Innovation Hub, and today I'm talking to Deborah and Karen about Deborah's experience of using social prescribing. And together what we're going to do is explore the approaches and learning for non-clinical services and wider local and national implications and how we can look to improve service user experience. We really hope, we envisage this video is used as a learning resource, a resource that is visual and is powerful and allows staff and wider service users to see the experience through that different lens. So just putting ourselves in other people's shoes to see how they experience things. So first of all, coming to Deborah. Deborah, if you can introduce yourself.
Hello there. So my name's Deborah and I'm going to give you my service user perspective today. I am also a PPI rep and I work for BU Peer and the Dorset Innovation Hub, giving a patient perspective.
Thanks, Deborah. And Karen, over to you.
Yeah, so I'm Karen Wilshurst and I'm a service manager at Health and Care, overseeing health and wellbeing coaches and social prescribing link workers in Dorset.
Brilliant. Thank you, Karen. And Karen, before we sort of get into some of the detail of Deborah's experience, I just wonder, could you provide an overview of social prescribing and why you feel social prescribing plays such an important role?
Absolutely. So for me, social prescribing is about connecting people with services, organisations or groups to support their wellbeing in a non-clinical way. And social prescribers, or link workers as they're sometimes known, are there to help people either self-manage through gaining more knowledge and information and confidence about where they can go, or in some cases be assisted by the social prescriber to negotiate their way to the right services and support.
Thank you. And would it be fair to say, Karen, that social prescribing really is gaining momentum both within the South, but also nationally as well?
Absolutely. I mean, social prescribing now is embedded into NHS primary care services and already is starting to filter out through to some of those other services as well. So if you go to a GP surgery in England, you'll certainly find social prescribers attached to those surgeries.
Brilliant. Thank you, Karen. And Deborah, thinking about your story, thinking about your experience of social prescribing, can you give a brief background of why you contacted the social prescribing service?
Yeah, just due to a health change about 14 years ago, it takes away quite a lot. So I've been going through some quite difficult circumstances regarding a multitude of things, but my health, debt. So I reached out to Help and Care because I was hoping that I would get some support or possibly signposted to people that could help me. And I felt quite hopeful at this point. I was contacted by a social prescriber after initially going via my GP. I wasn't able to get the support that I needed. And unfortunately, there was misinformation given out to me. And I also felt there was a sort of lack of concern from the social prescriber herself. I felt almost like there was burnout where the person is just almost not coping with the job. There was issues around my medical records. I didn't realise that they would have access to these. And the reason I needed my medical records because I was applying for PIP, which is an extra benefit, which would have helped me financially because I'm literally fighting to hang on to my property right now. And she gave me hope that I could get 30 minutes with a solicitor. So that really, you know, gave me some hope. I thought I would get some good sound advice. And unfortunately, they were only, the solicitors were only dealing with family litigation. So they couldn't help me with the advice that I needed. I did express this to the social prescriber, but she didn't really seem that bothered. So I think it's important to give out the correct information. I was also quite shocked that they were allowed to add to my medical records, and there was there was a query as well over one of my medical diagnoses, which again, this medical information was going to go to PIP, and it could basically make or break whether I get PIP, which would then make or break my situation. So it was really stressful for me, like super stressful and disappointing as well.
Just thinking for our viewers that might not be aware, what's PIP? PIP.
Oh God, I knew you were going to
Karen?
ask me that. And I always, personal independence payment.
Personal independence payment.
Yeah. So it
you.
can give people a little boost, even people that are working. So it just gives them a little bit more, but you do have to jump through many, many hoops to get this, and they need a lot of documentation from you, hence why it was so important about my medical information being correct and not questioned, you know, like queries over diagnosis that I already have, which was really upsetting for me. Yeah.
Deborah, as you've outlined, and I know you've outlined briefly, obviously, from the conversations that Karen and I have had with you, you have expressed the fact that you don't want others to have the same experience as yourself. It's, in your words, has been a negative experience, but you want to turn that into a positive and hopefully to help others in the future. Thinking about the experience you've had, how did that make you feel?
Oh, a multitude of not very good things, to be honest. I felt really disappointed. I felt let down, and it was almost like, where do I go now with all of this? Because I felt I'd exhausted pretty much all the options open to me. And you know, people need to remember that they are dealing with really vulnerable people that are struggling on a multitude of levels, and it's just putting yourself in someone else's shoes, and I wouldn't want someone else to have that same experience.
Thank you, Deborah. Thank you. And Deborah, just thinking about, you know, you've talked about that you want to turn this into a positive, turn the experience into a positive, a learning opportunity. We always think about, you know, what's worked well in situations and what would have been better if. So are there a couple of examples you might have? Thinking first of all about what worked well. What do you feel worked well?
The really positive and what really gave me hope was actually my initial phone call, and thereafter I spoke to this particular lady who was like a reception point, but I think she is also a social prescriber, and I really wish I'd got her, because I think possibly my experience would have been very, very different. She was amazing. She just made me feel totally at ease. I felt supported, and I felt quite safe in her hands. And I felt she would have maybe I just know I would have had a very, very different experience. So I was quite shocked when I did speak to my designated social prescriber, which it was a very different experience. So if we could have loads of this lady everywhere, the world would be a nicer place. And Yeah.
So could I just explore that just a little bit more? What do you think it was about this other lady that you felt was very supported, you felt safe? What was it that you felt she did that enabled you to feel safe and feel supported?
She definitely listened to me. She had what I call the human touch. I felt she understood. She knew how to guide me, point me in the right direction, just feel at ease. I just think it's that human connection, and I felt that I connected with her, and that can again make or break an experience. I feel, yeah, she was just what I call user friendly.
Nice. Thank you, Deborah. And then thinking about what would have been better if, what would be an example of what would have been better if, thinking about your social prescribing experience?
Again, as I said just now, if I could have spoken to that lady and she'd been my social prescriber, I just feel it would have been a very, very different experience. And I just sort of sense that sort of disengagement from the other person, the other social prescriber. Yeah, I really felt it strongly.
Thank you, Deborah. And just thinking about some of the points that you've raised with Karen and I before, you were talking about perhaps an understanding of who's at the other end of the phone. So perhaps that perspective of seeing you as a person, seeing you and realizing your concerns. So again, it's that putting yourself in that other person's shoes. And the other point that you raised that I think is really important that people are able to hear is about actually sometimes don't give information if you're not sure. Did you want to build on that in your own words, Deborah?
Yeah, it's something that really resonates with me because before my change in health, I worked as a mental health professional. So I know the importance of giving out the correct information. And if you don't know what the answer is, then you go and you speak to a colleague, you speak to someone else. It's better to say nothing at all, or just be honest and just say, look, I don't know, but I will find out for you, and not to give misinformation, because it's so important, because no one knows what's around the corner and when they might need help themselves, or a family member or someone close to them. It's so important to treat everyone as an individual. And yeah.
Absolutely. Thank you, Deborah. Thank you for that. So just before we come to Karen, just I suppose a few framing points. So what we want to look at is the framing of how we've got to the point where we are speaking by way of this conversation, listening to Deborah's story, but also looking at key learning points from this, and how we can use this as a positive learning resource for others as well moving forward. So Deborah outlined her experience to me as part of some wider work of the Dorset Innovation Hub, and I was immediately struck by the fact that the story, the experience that was being said, needed to be highlighted to others. So liaising with Frances Avis, our NHS Dorset Head of Patient Engagement, she encouraged me to speak to Karen, who, thank you, Karen, you have responded so quickly to look at this, and obviously to ensure that there is learning from the experiences. So thank you so much. Karen, hearing Deborah's experience and the impact of this powerful story for all of us, I think there's wider learning, as we've said earlier, for non-clinical services locally and nationally. So we're trying to have this conversation in a way that's more generic. But Karen, from your perspective, what do you feel are the key learning points and the next steps?
Thank you. And thank you for Deborah for bringing this to us. I think there's a couple of things from an organisational point of view. Obviously, we want to look at that that individual situation, which we've done. But I think it's important, first of all, for people to know who and how to raise concerns and complaints. So in this instance, when we understood about the issue around the medical records in particular, which I'll go on to in a minute, action was swiftly taken as soon as we had that issue brought to our attention. But Deborah wasn't left with a sense of completion or confidence that it might not happen again. So even though, yes, on the day things were done, to rectify that, actually, it's but what happens, and like you say, this learning needs to come from that and needs to be brought to a wider attention. So I think that's really important. And then I think also, if we talk about that part around the medical records, I think it's just important to highlight that social prescribers, certainly with health and care, cannot go in and change medical records. We don't have that access. However, what we do is we are able to make notes on medical records about the intervention or the interaction that we've had with somebody. And on this occasion, the notes were inaccurate and they contained unnecessary information that didn't have a bearing on the support that Deborah was seeking from us. So I think from our point of view, some of the learning and some of the training that we've been discussing with you both has been around the language that we use and the appropriateness of the records that we're talking about. Because if Deborah is going to a social prescriber, or anybody's going to a social prescriber with a specific issue, you don't need all the other information. It's about that and what's important and what's relevant. So I think that's really important. I think what we want to see as an organisation with our social prescribers is consistency. We need that good person all the time, don't we? And actually, if people aren't performing or don't feel that they can perform or deliver in that way, well, why is that and what are the reasons for that? So I think there's something about that consistency. We need to be making sure that our staff are contracting and being boundaried. So Deborah, I think you were talking about, a number of services or support that you were seeking. And actually, it might have been really useful to have a longer conversation about actually what is it that social prescriber can truly deliver and whether there were some limitations as to what that might be. And I think that's just really important. And again, we do talk about that in our training and our recruitment, but equally it's important to make sure that's reinforced. And I think then, the correct information, absolutely, of course, you want people giving you information that you can use and you can utilise. There is sometimes an element of us allowing people to make their own investigations, but there's got to be some reality to that. And so there's no point in us giving you, hundreds of organisations that aren't relevant or aren't accessible. So I think that's really important. Since we've reviewed this particular incident further and have had conversations with Deborah to understand the impact, we've looked at improving our training to staff and our record keeping governance. And we're already actually at a stage where we're on, about to roll that out. But what we want to do is involve Deborah further in making sure that Deborah's experience is part of our training and part of our learning and part of staff understanding a patient voice and really hearing that side of it. So that will be going ahead and we're having those ongoing conversations. I think the other thing I would just say is we need to ensure that there's quality oversight. So it's all very well having the training, but we need to make sure that our quality oversight is there and there's processes for that. As more and more non-clinical services are brought into the NHS arena and other statutory settings, I do think it's important that there needs to be consideration at a system level in Dorset as well as other areas in terms of co-production around guidelines and good practice for good record keeping and language. So, the staff performance side is absolutely up to organisations and services and companies. But I think that other side of things about we have lots and lots of different systems in Dorset. We have by name Rio and IAPTUS and System One and our own CRM systems. We've all got different systems, but actually the language and the way we're recording people's, lives should be maybe something we look at in a co-production way to get some really good guidelines and best practice for Dorset, which would be really helpful, I think.
Thank you, thank you, thank you. Just as we round up, I'm just struck by the importance of this story, of Deborah's story. So huge thank yous, Deborah, for sharing the story with us, and Karen, as I've said, the Help and Care team, for yourself and the Help and Care team for your response, and for taking swift action, for taking this so seriously and wanting to take the right steps to actually create the learning and the opportunities for this video to be a resource. It's clear social prescribing has a fundamental role to play in clinical pathways and can have huge benefits to people as well as supporting with system pressures. And it's so important. And perhaps that's something we can explore wider within the system about how we can get a consistency, as you've said, an approach to record keeping and governance that is beneficial for all. So as we've highlighted, this video is going to be used as a training resource as part of the health and care training and record keeping governance to ensure that, Deborah, your experience further harnesses the power of social prescribing, getting the power of social prescribing so it is consistent, so you have that experience, others have the experience that is that standard, as we've talked about. And it's also our hope and my hope, our hope, that the wider discussion, and as Karen said, about the system level approach to co-production of guidelines and good practice for record keeping, thinking about the language, thinking about that good practice, and perhaps we can throw that gauntlet out there and we can have wider conversations. So just as we sign off, just want to say to people that are watching this video, many thanks for watching. If you want to find out more about the work of Help and Care, please do go to www.helpandcare.org.uk, and to find out more about the work of the Dorset Innovation Hub, please go to www.ourdorset.org.uk/innovation. So just signing off, it is with huge thank yous to Deborah, huge thank yous to Karen, and thank you for watching the video.
Thank you.